Okay, Herbies, we're into part two of the political history of herbal medicine. And we're at the point where we're saying where we are today and some of the issues that we face today. And this whole question is really a consumer-driven revival. We've got at least half the U.S. consumers that want alternative care. We have an herbal supplement industry alone that's worth $65 billion and should double within the next 10 years. And this is being driven by people who are either working with practitioners or trying to take care of themselves. We have licensing for acupuncturists, naturopaths, nutritionists, and wellness counselors, but not for herbs. So we're going to explore that just a little bit. And so the question becomes, what would it look like for an herbalist to be recognized as health practitioners? And it's going to be built off of three components. One is legal recognition and consumer access and consumer confidence. So right now we have increasing use of herbals. We have increasing visibility of herbals. Research is increasing in this area as well, but we're being limited by some legal issues that originated 100 years ago based on the Flexner Report. And so it becomes really important to question the history of herbal medicine to uncover the bones of how decisions got made. And so we went over those bones in part one, and it should give you some sense of what we're facing today. So we've got consumers that are looking for these alternative approaches because you've got desire for effective treatment for more chronic diseases that folks are facing today, to find access to worldwide health information. They're looking for individualized therapy. They're really interested in self-care, empowerment, and to be part of that healing process. And with respect to pharmaceuticals, they're looking for minimal adverse effects, lower cost, and this whole paradigm shift to the idea of wellness or resilience away from the idea of disease. So in general, when we talk about federal protection for health care in consumers, the Bill of Rights protects citizens from federal encroachment. But the courts, in using precedents, really haven't agreed on a constitutional right to medical care of our choice. The 14th Amendment probably is the most fertile ground, with a focus on privacy rights translated to our ability to go out and decide, hey, we want this type of health care. So the states have been the real linchpin, and they regulate the practice of medicine. Since 1888, Maryland has licensed only graduates of medical schools or those who pass licensing exams, and the specific definitions are based on licensing by Board of Physicians or those healthcare professions. Now there's several licensed practitioners that are allowed to practice herbal medicine: naturopaths, chiropractors, acupuncturists, and physicians. But legally speaking, we don't have a licensed herbalist. Another area that's been explored to get around the issues of licensing are health freedom laws. These protect alternative and complementary medicine practitioners, including herbalists, that basically say you're not conducting clear medical practices like surgery, you're not doing any harm, you're not pretending to be a physician or licensed, and you disclose your education, your training, and your services to your clientele clearly. This would be the requirements of health freedom laws. This hasn't passed in our area, Maryland, Virginia, or DC, but for those of you attending from other parts, you can check on this website and also see that the health freedom laws have passed in New Mexico, Arizona, Louisiana, Rhode Island, California, Minnesota, Oklahoma, and Idaho. And most of these have taken part in the past 20 years. But what they do is they protect consumers, and they eliminate prosecution for practicing without a license. And it's a shift away from the supremacy of allopathic physician expertise and control of healthcare choices, and it embraces patient responsibility in this whole wellness question. So the question really then, I'm sure you're asking, is why is there no licensing apparatus for herbalists? Well, 5 or 10 years back, a group, APA, which is a trade association, and members of the American Herbalist Guild did actually try to begin to bring this up. The timing seemed right, but there were a number of herbalists that did not want licensing. They felt like there shouldn't be an apparatus that should tell herbalists when and where they can practice. And this is an important point. There's a lot of disagreement within the herbal community. This is a group of renegades. These are folks that say this is earth medicine. Who can control earth medicine? I think in some respects there's still the regular versus root doctor fight going on even within the herbalist community. So this is something I think will come up again in the AHG sometime in the next few years. Whether it moves forward or not, we'll have to wait and see. But one of the things we do want to take out of this whole movement of health freedom laws is that there's some issues around language. And you'll hear more of this, particularly those of you that begin to move more into clinical realms. In terms of diagnosis and treatment, we don't diagnose and we don't treat. Instead, we assess physiological function rather than diagnose pathophysiological conditions. And instead of preventing, we act as educators in terms of promoting and maintaining wellness. And we're there to support decisions made by our consumers that come in. So our clients, they're not patients, but they're clients. So this is really use of language so that you don't find yourself speaking the language of a practicing physician. Also informed consent, full disclosure. This is really also an important area of our practice now, that these full disclosure documents that we'll use in practice really outline the services to be provided, the background on training and expertise, roles and responsibilities in practitioner-client relationships, and would note that we're not actually practicing medicine. So this is similar to the healthcare freedom laws, but they're being done in terms of directly in a client-clinician basis. California's provisions on full disclosure gives you an idea. I think California is probably a good model. It notes that a practitioner is not a licensed physician, that the therapy is an alternative, that the services to be provided are not licensed by the state. It details the nature of the services to be provided, the theory of treatment on which the therapies are based, provides educational background and experience regarding those services, and it obtains a written acknowledgement from the client that they've been provided all that information that was just run through. So this is really a smart way to have practice, and this is what you'll learn in your practice management classes if you end up in the clinic. Now there are a whole other area that involve medicine making, which are GMP requirements, and this is really a whole other discussion. You'll find this in some other classes that you'll take, as well as if you do any kind of internship in the dispensary. And this is also a ripe area for research projects later on in the program for those of you that stay in the masters. So for our final discussion, what I want you to be able to do here is to use that initial information you provided about your herb and the way they were packaged in the products you just chose in discussion 1. And I want you to go a little bit further here. I want you to provide your assessment of the quality of those herbs by thinking a little bit more and elaborating on their marketing angle. How are they actually marketing this product? Sometimes there's subtlety in language. To actually assess the accuracy of their product claims, assess the level of detail provided about the plant source, the parts used, the name of the plant. Does it include both the scientific and the common name? The quality of the preparation. Does it provide information on the extraction solvent, the ratio of the extraction solvent, the ratio of the plant material with respect to the extract used, if there are other fillers, how long was something extracted, what other, is this a powdered form, is there any kind of quality assessment on the label, anything that you can use to say this is a quality product or not. Again, you're coming at this with some basic information, but this is an opportunity to stretch yourself and to learn from your fellow classmates to see who actually went a step beyond. So I'll see you in the discussion board, and I thank you for your time.